Ways of treating infertility are made with several steps in IVF. Depending on each case causes, the professionals will determine the optimal method to treat it. Many factors can prevent sperm and egg from union. Luckily, art like IVF can help. IVF is an assisted reproduction process in which the sperm of a man and the eggs of a woman are mixed in a laboratory dish outside the body. There are several methods to do IVF treatment. In IVF treatment process, the basic steps are ovarian stimulation, regeneration of sperm, fertilization, embryo extraction, and transfer of embryos. Ovarian stimulation. Medication or fertility drugs are used during ovarian stimulation, also known as ovulation induction, to stimulate multiple eggs to grow in the ovaries, rather than the single egg that normally develops every month. Several eggs are stimulated because after fertilization, some eggs don't fertilize or develop normally. During treatment with vaginal ultrasound examinations, the ovaries are evaluated to monitor the development of ovarian polyps. Blood samples are taken to assess drug response to ovarian stimulation. The levels of estrogen usually rise as follicles mature, and the levels of progesterone are small until after ovulation. The physician can determine when the follicles are ready for egg retrieval using ultrasound examinations and blood tests. Stimulation generally takes 8 to 14 days. Egg retrieval. Egg retrieval is usually performed by transvaginal ultrasound aspiration, a minor surgical procedure that can be conducted in the office of the physician or an outpatient center. To locate the follicle, an ultrasound probe is inserted into the vagina and a needle is directed through the vagina into the follicle. The eggs are removed from the follicles via the needle connected to suction system. Less than 30 minutes, multiple eggs are usually retrieved. On the day of the healing, some women experience cramping, but this discomfort typically subsidizes by the next day. Fullness and oppression sensation may last several weeks after the operation because the ovaries remain swollen. In some cases, transvaginal ultrasound may not provide access to one or both ovaries. Using a small telescope placed in the umbilicus, laparoscopy may then be used to extract the eggs. Fertilization and embryo culture. After the eggs are retrieved, they are checked for maturity and quality in the laboratory. Mature eggs are placed in IVF culture medium and transferred to an incubator, waiting for the sperm to fertilize. Fertilization can be conducted by insemination where mobile sperm inserted together with oocytes and incubated overnight by intracytoplasmic sperm injection, when foreign sperm is injected directly into each mature egg. Intracytoplasmic usually occurs when there is a probability of decreased fertilization, for example, low semen content, history of failure in previous IVF cycle. Genetic counseling is advisable before intracytoplasmic if there are identified inherited abnormalities which can be passed from father to child. Usually, 65 to 75% of mature eggs fertilize following insemination. Lower rates may occur when poor quality of sperm and/or eggs. The fertilized egg has split into 2 to 4 cell embryo 2 days after the egg retrieval. By the third day, an embryo that usually grows will contain about 6 to 10 cells. By the fifth day, the embryo develops a fluid cavity and the placenta and fetal tissues continue to differentiate. One embryo is called a blastocyte at this stage. Embryos may be transferred to uterus within 1 to 6 days of egg recovery at any time. When successful development continues in the uterus, the embryo hatches from the surrounding zone, the lesuda, and implants into the uterus lining about 6 to 10 days after recovery of the eggs. Embryo transfer. The next step in the IVF process is the transfer of the embryos. There is no need for anesthesia, though some women may want a mild sedative. The doctor identifies the cervix with the help of vaginal speculum, a moving catheter, a long thin sterile tube with a syringe at one end draws one or more embryos suspended in a drop of culture medium. The doctor carefully guides the tip of the transfer catheter through the cervix and places in the uterine cavity the fluid containing the embryos. The procedure is typically painless, although some women have a minor cramping experience. Cryopreservation. Extra remaining embryos may be cryopreserved, frozen for future transfer after transmission of the embryo. Cryopreservation makes future ART cycle simpler, less expensive, and less invasive than the initial IVF cycle, as the woman does not need ovarian stimulation or recovery of the eggs. Embryos can be preserved for extended periods once frozen, and live births have been recorded using embryos that have been frozen for nearly 20 years. There are two methods of cryopreserving embryos: traditional, slow freezing, and vitrification, or fast freezing. While some reports claim that a solving wormy vitrification may have higher success rates, this is not the case at all centers. Ultimately, although there are potential dangers, it should be remembered that the freezing of sperm, eggs, and embryos is very healthy.